I'm Jack Pattie. Dr. Kevin Kavanagh is a retired physician and founder of a national organization called Health Watch USA. Good morning, Dr. K.
Oh, good morning, Jack.
How you doing?
I'm doing very good.
Good. We already have a text for you here. I wanted to share with you, I think you'll really appreciate this from your perspective. And I know you're very conservative when it comes to this virus and very cautious. Cautious is probably a better word. I was in contact yesterday with a friend. She is a microbiologist and her husband is a physician. And she said that they have actually lost friends because of the virus. And by that, disagreeing as to how cautious to be. Does that surprise you in any way, shape, or form?
Well, no, it doesn't. People are getting very emotional over this because some people believe the science. Some people don't believe the science. They get hung up on a data point or a statistic, don't really understand how that statistic's biased, and it takes you too long to explain it to them. And so they get very emotional, and then they start thinking it's Republican versus Democrat, which to me is confusing because the whole world is fighting this, not just our country.
Exactly. We got a couple, 3 texts already. Okay, it says, please ask the doctor if these COVID patients are being checked for tuberculosis or if they have a history of a positive PPD test for the TB germ.
Well, I really don't know for sure, but whenever you admit a patient, you get a full history of the patient, his infectious diseases, and what type of symptoms they have. So there are many different types of infections, and you can get co-infections, which I think this caller's concerned about. And that's certainly something that we want to make sure patients don't have. And of course, one of the ones we're really concerned about is if you can get the flu, the seasonal flu, plus COVID at the same time. That's been reported in at least one patient. And if that happens widespread, that could be devastating. So yes, you do need to check for co-infections when a patient comes in with COVID. That's very important.
All right, this one's from Deb. Asked Dr. K what are his thoughts about using UV lights to kill the virus, specifically as advertised for use with heating and air conditioning systems.
Well, I think that would be very good. I'm a big fan of UV light, but you need to make sure that you've got a product that's properly installed and effective. I'm not very good at filtering out which are the sham and the fake companies versus which are going to be the effective ones. But I do feel that as we're gathering more and more evidence on the aerosolization of this virus and how it can sometimes spread far through the air, we really do need to look at our cleaning of the air, filtering of the air. And as you know, I've talked about this with our schools. I think we need to look at airflow, air filtration, and cleaning in our schools.
Where do we go from here, Dr. K? What do you want to talk about?
There's 2 issues. One is the CDC, and the other is, of course, the athletes in Kentucky, if they should be playing on a high school level. The CDC question, been pretty disturbing to me, is that they've changed guidance that you do not have to go out and search for asymptomatic carriers and test asymptomatic individuals. And you've heard just a huge outcry from the public health experts regarding this. I think that this is a mistake. We've been on this show just for years, over a decade, Jack. And one of the things we've tried to drum home is surveillance, detection of dangerous pathogens, and when you do find them, you isolate the carriers. This is true for MRSA, it's true for COVID. And this hasn't been a philosophy that's been universally adopted by our healthcare professionals. And now with COVID, when you don't have an alternate treatment that's effective, everybody wants to do it. But really the stage has been set for this type of an attitude with dangerous pathogens for a long time now. We need to have a national reporting system for all dangerous pathogens, not just COVID. This isn't going to be the last. And in fact, we're still up to our ears in COVID. We don't have this even starting to come under control. So we got to take this seriously.
Okay, go ahead.
Yeah, and I was going to say that kind of brings us into the school athletes issue.
Yeah. Yes, sir.
And that's, as you know, is coming on board Kentucky. It's been very prominent in people's minds is what should we be doing with athletes? And again, the narrative has always centered around, well, children don't die as much, they die rarely, therefore it's safe. And there's two big flaws in that. One is that we have good evidence now that children can be very infectious, especially at the time when community levels of the virus are very high. And that is very important because you don't want them spreading this virus to their parents or grandparents that are at home. And of course, as you know, in Kentucky, with the opioid epidemic, many times the children are taken care of by grandparents or even great grandparents. But
Right.
the other factor is, and people need to realize that this virus affects every organ of the body. And that when you recover, that probably isn't a good term. You actually survived. Many of the patients still have heart problems, kidney problems, lung problems. And that the reason why the Big Ten and Pac-12 postponed their football season isn't because of deaths, but because of fears of myocarditis or inflammation of the heart. Dr. Kurt Daniels of Ohio State University says that of their athletes that have COVID-19, 10 to 13% of those are developing cases of myocarditis or inflammation of the heart muscle. And this is why they postponed their season. So this is very serious. And I do not feel that if we're closing schools, we're encouraging churches not to meet indoors, that we should be having contact sports at this time.
Let's go to the phones. Laura, good morning. You're on the air.
Good morning, Jack. Good morning, Doctor. Listen, I have a question about the Legionnaires disease. When I was a kid and that first hit the news, my dad was a construction worker who had just found out he had emphysema, so he had a lot of attention in that area. And he said that there was absolutely nothing new about that disease except the name Legionnaires. It had been there forever, of course. But at any rate, I was wondering if some of the patients coming into the hospitals now testing negative for COVID, if they might have Legionnaires. We had a large building in downtown Frankfurt that was taken down and replaced recently because it was basically just diseased, from bad ventilation and stuff like that. Just an idea, though. Could some of this be Legionnaires, and do they need to be looking for it?
All right, Ken, Laura, I'll let you listen to this reply off the air. Go ahead there, Doc.
Well, I mean, yes, you always look for co-infections or other causes of disease, especially when you have a negative test. Legionnaire's disease has been a disease which has been around now for a couple of decades, or at least we've known about it for a couple of decades. As you know, it's associated with water inside the plants and buildings, and that is something that needs to be looked at along with many other types of infections. But COVID-19 is starting to have a good case definition. It has X-ray changes, which are peculiar to the type of infection, and it has a particular case course. In other words, patients tend to progress a certain way. So although there can be outliers, the vast majority of patients that are diagnosed with COVID are diagnosed with a positive test plus symptoms, and those that are just diagnosed with symptoms tend to fit a fairly tight case definition. And for the outliers, they're always looking for other types of infections.
Here's a couple more texts we have from our auto text service text line. This is a good question. If a person recovers from COVID and they die of a heart attack or some other ailment, is that still considered a COVID-19 death?
Well, it's going to depend upon how closely related they are. And we've gone into this before with COVID. It affects every organ of the body. We just talked about how it causes a myocarditis. It causes a hypercoagulation of the blood. And so that if you have 4 weeks later a heart attack and COVID causes your blood to coagulate more, heart attacks are a coronary thrombosis or coagulation of blood within the heart. Is that associated? And I would say yes. Now, would they have died without the COVID? Maybe not. Maybe yes. Those are going to be outlier cases that, with a virus that affects every organ of the body, becomes harder and harder to judge. And that's why you need to look at historical death rates and excess deaths for this time period. And I can tell you, using CDC data, as of August 1st, the United States has over 200,000 excess deaths based upon historical data. And so that's going to be, I feel, one of your most accurate metrics to come up with the total number of cases. And believe me, it is far too many.
All right. Do you think large groups of protesters causing COVID-19 to spread faster?
Well, anytime you have groups together, it's going to increase the chances of spread. It doesn't matter what the reason why they're gathering, whether it's a political event, whether it's a protest, whether it's a demonstration, it makes no difference. Or whether or not you're laying on the beach, on a crowded beach. Anytime you have people in close proximity, you increase risk of spread. Outdoors, however, is much less riskier than indoors. So the reason why you're gathering is immaterial to the virus.
All right. Finally, alternative treatment, Dr. Zelenko protocol, hydroxychloroquine. I thought they determined a while back that didn't work.
Right. I'm very, very upset that we're still looking at that. In fact, now they're jumping to a new alternative medicine, that oleander or whatever that drug's name is. It's crazy. And that protocol is extremely dangerous because remember, this heart has a myocarditis, the hearts of the COVID patients. You're taking hydroxychloroquine, questionable effectiveness, causes arrhythmias, prolonged QT intervals. You add on top of that an antibiotic, azithromycin, which also prolongs the QT interval. That, to me, is just a toxic mix. And I would really like to know who thought of putting the antibiotic azithromycin with hydroxychloroquine, where you have added toxicity. I mean, to me, it almost sounds like it's some, plot that was done. It makes no sense.
Thank you very much. Talk to you a week after next.